Hi, this is Dr. Carr, and this week we are looking at breast cancer awareness. This will be part one of three. Breast cancer is the most common cancer among women in the U.S. In 2017, over 270,000 people are expected to be diagnosed with breast cancer. Also, 40,000 are expected to die in 2017. So we want to look at some things where we can address this issue head on. One strategy from a health or a alternative health perspective is make sure that we get a good assessment of our hormones, especially early in life if you have cycle issues or PMS or just different hormone issues. That can be a red flag right there that something may be off. Although not all breast cancers are hormone driven, it is important to kind of get a good assessment of the hormones. And one of the best tests out there for getting a comprehensive assessment is the Dutch test. One of the first things the Dutch test picks up on is whether or not someone has an estrogen dominance or not. And this is just simply looking at estrogen and the relationship between estrogen and progesterone, not only the values but also the ratios. What makes the Dutch test kind of unique is that it goes and shows you the breakdown of the different estrogens and their pathways, and also a process called methylation. How well is the body clearing these hormones? And this is what really sets the Dutch test apart from a lot of other tests. And it's what the body is able to do with these hormones can tell us a lot about whether if you're going to be protective, or is it possibly causing damage to the DNA, which could put a person at risk. And if they're not being able to methylate their hormones, that's a major problem, and this test can actually show that information. Another key marker the Dutch test picks up on is melatonin. And melatonin is a powerful antioxidant in the body. And been a lot of studies that show a relation, or actually inverse relationship, between melatonin levels and postmenopausal breast cancer. That means when melatonin is low, the chances and risk of breast cancer kind of go up. Or if melatonin is high, that would lower the risk of postmenopausal breast cancer. So this is another key marker that the Dutch test picks up on. So we've only covered two main things. Look a little bit at estrogen and its different pathways and methylation, and also talked a little bit about melatonin. And there's a lot of other things that Dutch test also picks up with, like testosterone, progesterone, and cortisol that we haven't even talked about yet. But long story short, the Dutch test gives us a good idea of what's going on with the adrenals or the hormones. And this can be really strategic in making a comprehensive integrative program for anyone that wants to be preventative, or even if they do have breast cancer, to know how the body's actually methylating and dealing with estrogens can be really important. It can be an indirect way of actually assessing also the liver. How well is the liver clearing these hormones from the body? So if you're interested in learning more about this, or you would like to purchase a hormone test, you can go to myhormonetest.com and purchase the test there.